Yeah, I'd like to thank the organizers for inviting me here. It is humbling to be part of this conference. There's so many great presenters, and they all do such a great job. I really don't have anything specific to disclose other than the fact that I just realized I think this is the 13th year in a row that I've been invited to give a talk about fibromyalgia to this conference. And early on, I kind of thought I was kind of flattered that they, kept inviting me. But now I've come to realize that it's mainly because they can't really find anyone else who wants to give a talk about fibromyalgia. So I'm it, apparently. I'm kind of curious, why is it that fibromyalgia, that diagnosis, engenders so much fear and loathing, or fear and trembling, I guess I should say, in a lot of providers and then also in their patients. And I think it kind of is illustrated by a typical presentation or scenario. The typical patient is a middle-aged female kind of coming in and coming to her fourth physician, complaining of, I hurt all over the place, my whole body hurts, I'm tired all the time, I sleep all the time, yet I'm unrefreshed, my brain isn't working right. And then the doc sees her and does an exam and runs a bunch of tests, repeats a bunch of tests, and then bops into the room and says that, well, the good news is I can't find anything wrong with you, so I think you're okay. I think there's really nothing wrong with you. And in the back of his mind, he's thinking, oh, this poor patient, she's kind of pathetic, and the patient is thinking in her mind, this poor doctor, he's an idiot. And that's why it's known as an idiopathic disorder. So, but as far as the objectives for today, I think we need to have you be able to describe a little bit the evolution of the muscle pain syndrome. To knowing a little bit about how these things developed over time is helpful. Be aware of the diagnostic criteria, describe the role of central sensitization, and then outline a treatment approach to widespread muscle pain. So really, the family tree of muscle pain syndrome starts in literature. The 1700s was just musculoskeletal pain, was kind of all mixed together. Then they started talking about joint pain, which was rheumatism, muscle pain, which was muscular rheumatism in the 1800s. Around 1900, this concept of fibrositis came out, and it was more both kind of localized pain with nodules and also regional pain and more widespread pain. It kind of covered the gamut. In the 1940s, Travell and Simmons are a couple of docs that coined the term myofascial pain.